Hello cruel world. To me, it's remarkable how little the general public knows about psychiatry and psychiatrists and what we do and what we don't. There are several thousand psychiatrists and trainees in the UK working today, and 1 in 4 people will suffer from a mental disorder in their lifetime. So to put that into perspective, only a minuscule proportion of the population will need something like cardiac surgery in their lifetime, but everybody kind of knows what a heart surgeon does. So to me, there's a bit of a mismatch, which is why I am making this video. Hello everybody, my name is Dr. Sohom. I'm a Consultant Forensic Psychiatrist. I assess mentally disordered offenders, so you don't have to. This video is about some misconceptions about psychiatrists. So some of these are quite general and some are misconceptions that I've personally heard. So number 1, psychiatrists are not doctors. So just to set the record straight, all psychiatrists are doctors. You have to go through 5 years of medical school here in the UK. You have to work at least for a minimum of 2 years as a junior doctor working in general medicine on surgical wards and on medical wards in hospital. And it's not uncommon for people who eventually become psychiatrists to kind of experiment and do different placements and different jobs as different types of doctors, because sometimes it takes a while for somebody to figure out what they want to do for the rest of their career. So to take me as an example, I worked for 6 months as an accident and emergency doctor in Australia, 3 months in intensive care unit. I also worked as a urology doctor. I did all of these things until I finally decided to work exclusively in psychiatry. By the way, as a little tip, it's really easy to tell if somebody is a doctor or not. All you have to do is look on the GMC, the General Medical website. Anybody in the UK who is a doctor has to be registered. It's open to the public, so it's really not that hard to tell. I think the confusion lies is that psychologists are not medical doctors. Psychologists can do like doctorates, like a PhD, and call themselves Dr. Smith, but they're not medical doctors. Which brings me conveniently onto misconception number 2, which is that psychiatrists and psychologists are the same. So I think I could make an entire video about the differences, and I think I will do that one day. But just to summarize, psychiatrists, such as me, who are doctors first, only deal with mental illness. We prescribe medication and we can detain people under the Mental Health Act. Generally speaking, psychiatrists do diagnosing the patient and they make the plan, whereas psychologists focus only on one aspect of that, which is the talking therapy. And it's not just for mental illness. They can also do this for people who are not mentally ill. So it can be about building confidence, helping somebody quit smoking, marriage counselling, sports psychology. So they can do things that are not related to mental illness, as well as treating people with mental illnesses. So as an analogy, I would say that psychiatrists are like architects and psychologists are like builders. So the architect makes the plan and it uses the builder for a very important part of the building process, but they still do the planning. And the architect might use other professions in making a house, such as an electrician, a plumber. So in the same way, a psychiatrist kind of leads the team and makes the plan, and they utilize different specialists like social workers and nurses and psychologists. Generally speaking, psychiatrists tend to have a bigger caseload, so they have more patients, but they have less time to see each individual patient. Whereas psychologists see a smaller number of patients, but have more time with them. So typically, they might see somebody for therapy for 1 hour every week. Psychologists only train in psychology, so they cannot prescribe. They don't have the knowledge of all of medicine. Next misconception, that psychiatrists are posh and have beards. What can I say? Cheers, Frasier. I think that some programs, Good Will Hunting, another good example, reinforce the stereotype. I would say from my experience, having worked with dozens, if not hundreds of psychiatrists over the years, that very few of us are like pompous or bespectacled or bumbling. So a trainee psychiatrist can be as young as 25, and most people become consultants, which means that they've finished all their training to become independent doctors, usually around roughly about mid-30s. And generally speaking, our facial hair is sparse and it is well kempt. The other thing that I would say is that psychiatrists, I think, are quite ethnically diverse, especially recently. So to give you like a perspective, when I was inducted into the Royal College of Psychiatrists in 2011, where everybody had to go on stage to get their certificate, like literally hundreds of junior psychiatrists, and I would say over half of the people there were ethnic minorities. I think that's also a reflection on the diversity University of London. But I think it's changing. I think gradually more, the senior psychologists tend to be whiter and the newer ones that are coming in tend to be more diverse. And in terms of the poshness, my experience is that this is also changing, and I think that just reflects the passing of time. So decades ago, people who went into medicine, most of them, or came from private schools because you had to have a certain privilege, you had to have a certain level of education, whereas now, because of social mobility, people from more deprived backgrounds are getting into university in general, getting into medicine. So I think you're going to see a slow change in the kind of diversity of backgrounds. And that's not just psychiatry, actually, that's all specialties of medicine. Okay, next misconception, we like to lock people up. So yes, of course, some people do need to be detained against their will under the Mental Health Act. It's different to how it was done historically. In the past, just one doctor made a decision, nobody questioned it, and the patient would be detained. I think that's wrong. Nowadays, it's a lot more complicated. The Mental Health Act has very specific criteria. It's much more regulated, much more rigorous, and the criteria for detention centre around risk. So risk to the person, to themselves, or to other people, or a risk that their mental health will deteriorate without treatment. So what I'm saying is just having an illness in itself is not enough for somebody to be deemed to be detainable under the Mental Health Act. And in fact, there are many people with mental illnesses who function in the community, and to be absolutely blunt, there's just not enough beds, especially recently, in more recent times. So only the illest people who are acutely unwell get to go to hospital simply because of logistics. There's not enough beds for everybody. So I won't go through the whole process of how you section somebody. In fact, I've already done a video on that, so go check it out. But very briefly, to be able to section somebody, you can't just be a psychiatrist, you have to be Section 12 approved. And there's a lot of hoops to jump through. You have to have years of experience, you have to go on special courses, you have to have references from other senior psychiatrists. So you have to know your stuff, basically, to know the exact criteria for the Mental Health Act. And then even if a psychiatrist makes an application to detain somebody, a completely independent social worker and a completely independent other doctor have to come and agree with your recommendation. And after all that, there are other safeguards in place after a patient's detained in hospital. So for example, on a regular basis, an independent mental health tribunal consisting of another psychiatrist who's independent, a solicitor, judge and a layperson have to decide whether or not to uphold the section. And on top of all that, the hospital themselves, the hospital managers on a regular basis assess whether any individual patient should still be under detention. So basically, it's a long-winded way of me saying that a psychiatrist can't just lock up a person on a whim. There has to be decent reasons, it has to meet very specific criteria, and there's lots of systems in check to make sure that these criteria are being fulfilled, and also basically check my video if you want more information. Not only is it unethical to lock people up without decent reason, but it's actually more work. So that kind of connects to the next misconception, which is this, that psychiatrists get paid per patient. That's just strictly not true. Psychiatrists get an NHS salary, the same doctor NHS salary, the same pay scale, which depends on number of hours you do, your seniority. The exception to that would be private psychiatrists who see patients in clinic. I think they charge per appointment, but that's the minority of psychiatrists. Okay, next misconception, psychiatrists drug people up. So I take no pride in saying this, but in yesteryear, the treatment of mentally ill patients was barbaric. So people used to be locked up, they used to be over-medicated, they even used to be displayed in like these zoo-like asylums for the entertainment of the upper classes. And over-sedation was a tactic to control unusual or unacceptable behaviour. But that was, I'm talking hundreds of years ago. There's been a huge shift, just in humanity in general, I guess, but specifically in how psychiatrists do our work. So obviously, sometimes medication is necessary to control various symptoms like severe depression, hallucinations, delusions that can actually torture the sufferer. And sometimes we have to medicate people to quash their violent kind of impulses. Often patients can lack insight, so they don't know they're mentally unwell, or they're too confused to be able to consent to treatment, including medication. So this is given to them against their will. And a psychiatrist does have the power to restrain and medicate people against their will under the Mental Health Act. It's usually not the psychiatrist that actually physically does it. It's usually a nurse, but the psychiatrist makes the decision, they make the prescription, they write their names on the form. They're responsible if anything goes wrong. All psychotropics have side effects. Some of it's dose dependent, some of it's random, so you can't predict who's going to suffer from what side effects. So it's a balance. It's a balance of the side effects that are tolerant versus reducing symptoms so the patient has a better quality of life. Sometimes patients need to take medication to be able to be allowed to leave hospital. When possible, a good psychiatrist will involve their patient in the decision. Obviously, if somebody doesn't have insight, then they're going to struggle to be able to make decent decisions about what they need. But a good psychiatrist will discuss it with them and also will review this on a regular basis to review the dosages. And in fact, over-medicating a patient is counterproductive in the long run, because when you discharge that patient in the long run, if you give them too much medication, side effects are intolerable, they're over-sedated, then obviously they're going to stop taking them at some point down the line. So they're going to relapse, come back into hospital, you start from square one. So the point I'm trying to make is it's not in our interests to over-medicate patients. The next misunderstanding, and I hear this a lot, I bet you're analysing me right now. I bet you I'm not. Firstly, psychiatrists, as I said before, we deal with mental illness more than we deal with normal human interactions like psychologists do. So if you've not got overt symptoms of mental illness when you're talking to me, then I don't really have much to say about you, or I don't have much to analyse. Specifically, my specialty is forensic psychiatry. So most of the people that I see, either defendants in court or in prison, or patients in secure units who are already detained, most of them have like these shocking backstories, horrific childhood, severe mental illness, drug abuse, hearing voices, they have delusions. Some of them have committed several violent offences, some of them committed murder. So no offence, but the average Joe, including myself, is not really that interesting compared to the people I see. So for all those reasons, I bet I'm not analysing you right now. And also, just because you do something for a living doesn't mean that you automatically want to do it all the time, right? Like, if I was an accountant, I wouldn't calculate the tax returns of every person that I met. If I was a dentist, I wouldn't examine a stranger's mouth. Okay, next misunderstanding is that we tell you to lie on a couch and we ask you about your mother. So that is absolutely false. I think the reason this is a misunderstanding is because there's a distinction between a psychiatrist and a psychotherapist. So I've already told you what the difference is between a psychologist and a psychiatrist. To complicate matters even further, there's psychotherapists. So psychotherapists are a lot more similar to psychologists than psychiatrists. They specialise in long-term, regular talking therapy. Specifically, they might examine the patient's childhood, their background, and the impact of earlier experiences on their current personality and their current life. So psychotherapists can be psychiatrists. So psychiatrists can do all their medical treatment, training I should say, have the ability to prescribe, and then after all that decide that they want to specialise in psychotherapy, but that is only a very small proportion. Mostly psychotherapists are qualified psychologists or mental health nurses or social workers who've done one type of work and then later on in their careers do psychotherapy. If my office was big enough for a couch, I would only use it for siestas. And as for your mother, the only reason that I would be interested in your mother, well, we both know the answer. So I hope that was helpful and interesting for you. If you have any other questions about psychiatry or what psychiatrists do or don't do, then please feel free to ask in the comment section, or you can email me. If you have any questions about diagnoses or about mental health issues, or if you want to seek advice for you or for a friend, then you get in touch. I regularly make videos on this channel called Time for a Quick Shrink. Okay, so I have asked a lot of questions, and now I have some questions for you, dear viewers, which is this. Is there any aspect of your job that people frequently misunderstand? Do you have any experiences with working with psychiatrists? And if so, what were they like? Let me know, please, in the comment sections below. So, I'm going to take a quick break, and then I'm going to tell you about the next episode and welcome you to this channel. So this channel is a Psych for Sore Minds. I am a consultant forensic psychiatrist. I release videos every Tuesday and Friday. It's about a whole range of topics, some related to offending, because that's my speciality. Some, like this video, have nothing to do with offending and are more about the perspective of life from a psychiatrist. Sometimes I interview ex-patients. Sometimes I talk about specific diagnoses. Basically what I'm trying to say is that there's something for everybody on this channel. So coming up soon, I'm going to tell you about future episodes, but before then, I just want to share some news with you. If you watch my videos, you'll know what I'm going to say. I'm going to CrimeCon UK in September of this year. It used to be June. It's a massive crime convention, huge in the States, coming over to London for the first time ever. You're going to hear about serial killers, unsolved crimes. You're going to hear from criminologists, law enforcement agencies. You're going to hear from one particular forensic psychiatrist, and this is me obviously, is going to be talking about 2 real life cases that I've assessed of people who've killed their own family members. One had a mental illness, one didn't. So if you are a true crime enthusiast, you cannot miss out. If you want to cop your tickets, use the link in the description below and use the code PSYCH and you'll get 10% off your tickets, because I'm nice like that. So in the next few upcoming weeks on A Psych for Sore Minds, I'm going to have a range of videos. I'm going to do a video on a true story of a French psychiatrist who went off to kill somebody. And also I'm going to talk about the 𝐿_J Simpson trial, specifically why he was found innocent in a criminal court, but yet found responsible for the killings in a civil court. I'm going to talk about the difference between those types of law. So please subscribe to our YouTube channel. Not only does it help me out immeasurably, but it also makes your facial hair thicker and less wispy, unless you're a woman, in which case it does the opposite. I would love to chat to you guys a bit more, so please comment on my videos and I will do my best to contribute and to answer your questions. Follow us on Instagram, like our Facebook page, submit any episode ideas that you might have to our email, which is psychforsoreminds@gmail.com. Use the hashtag PsychSore if you want to reference us. Also, it's really important that you tell your favorite people about A Psych for Sore Minds, because they deserve it. You should spread the love. Until next time, stay euthymic. Please remember, I love you, but I'm also very busy, so please go away.